no undue cause for alarm, but I did want to make three key points to you all, and also to emphasise that we are still going to have to manage this pandemic throughout this winter and possibly beyond in a responsible manner. So first point I wanted to make is that COVID hasn't gone away. Please do not get lulled into a false sense of security that COVID no longer poses a threat to us. It does, it's endemic, and it's likely to keep coming back. So please do not be complacent. Secondly, get vaccinated and get your booster jabs. The vaccines are working, but as Henrietta Ewart has quite eloquently explained, their effectiveness will gradually reduce. So it's vital that when the time comes that you get your booster. And thirdly, be responsible. And that really means being aware of what is happening, where your mask is appropriate, particularly if you are in unfamiliar surroundings or using public transport or are aware of COVID cases in your area or close to family and friends. And crucially, use your lateral flow tests and use those tests on a regular basis, particularly if you are working or at school in busy environments. So we do have a winter framework, and we put one in place. And I just want to explain why we've chosen to put this framework in place, partially for the reasons I've just explained in terms of complacency, but also we cannot ignore the difficulties and pressures that winter brings when it comes to respiratory viruses, and that now includes COVID-19. The Council of Ministers has requested that a framework be drawn up, setting out how the island can best approach COVID through the winter months, but also to give clarity to everybody as to how we are likely to act. So the framework sets out three clear objectives: to minimise the harm and disruption caused by COVID, support people in making informed choices, and mitigate against the uncontrolled transmission of the virus. And all of this really is essentially to protect our NHS capacity and capabilities, of course our community and our island. We want COVID cases to be as manageable, at a manageable level as possible, so that life can continue as normal. And this winter framework sets out three response levels. Level 1, which is our base response, things that we all need to be doing now. It's those basics that will help prevent the spread of the virus, as we come to know. Hands, face space and fresh air, along with vaccinations, testing and mask wearing are all the sort of key essentials here. And it is about taking personal and collective responsibility as an island community and sticking to the basics to minimise the risk of the virus spreading. As I've already said, get vaccinated, please, and get your boosters. The vaccinations remain our greatest defence against this virus, but the protection, as we've emphasised twice now, wanes over time. So please turn up to your booster appointments, and if there are genuine reasons why you can't make it, then please rearrange the appointment by calling 111. And secondly, then, we have a level 2 response. And as we know, the virus is likely to spread more in winter. And we've seen a recent surge in cases, although that has come down significantly. But if the need arises, this is where level 2 fits in. Increased national mitigations, things we may need to do. So if the winter pressure increases the risk to our health and care provision, the public should expect to see us strengthening the advice that we give in a more robust way. What will this look like? Well, for individuals, it will mean an expectation that face coverings are worn where it is difficult to distance, where there is close mixing, or where ventilation is poor. We may ask people to test themselves more often, and we may have to revisit our testing strategy. We may also have to ask people to avoid unnecessary household mixing. And for businesses, it may mean that we are asking people to work where possible from home. So level 2 is about asking the public to do everything possible to reduce transmission of the virus and lower case levels. We do have a third level available. Level 3 is about legal interventions, an approach we want to avoid returning to, where government must tell the public what to do. This, in our view, is a last resort, and whilst I hope that we do not need to return to putting in place legal measures to compel people's behaviour, this option must remain open to us. So there are 3 scenarios where we anticipate a move to legal restrictions and measures may be necessary. 1, if our health and care services are in danger of being overwhelmed because of COVID-19. Secondly, if there is a new variant of concern that the vaccine may not protect us against. Or thirdly, if there is significant disruption to island life, such as the number of people having to isolate is impacting on core services, education, and or infrastructure. Our aim is to avoid this level of response, but as I set out at the beginning, if we are to avoid this, it needs all of us to take personal and collective responsibility and do our bit through the winter months to keep the virus under control. So this is a framework, a guide. Our response will need to shift and flex to meet circumstances. For that reason, there is no particular trigger for a move from one level to the next. I can tell you that a new national COVID response group has been formed for improved decision making, which includes representation from the chair of the Emergency Advisory Group. The group will monitor the position regularly with information on borders, education, data on case numbers and trajectory, and the status of our health and care system, economic indicators and community measures. There will also include and be monitoring of UK and international developments with recommendations that arise from any of this fed directly into the Council of Ministers for decision. So thank you very much, and happy to take questions on COVID and the winter framework. Yes.
That national COVID response group you mentioned at the end there.
Yes.
Who actually is on that in that group, and what's the difference between that and the emergency advisory group? So why doing separate?
That's one of the issues that we will discuss as we progress. But I think the key point is that we do have the chairman of the emergency advisory group brought into that group, which contains myself, the health minister, the Minister for Home Affairs, the Minister for the Cabinet Office, and as I said, the Chairman of the Emergency Advisory Group. And the purpose of that is to make sure that there is an integrated role for the Emergency Advisory Group in terms of the decision-making process at an earlier point. Yes.
What, if any, safeguards are you putting in ahead of time at the hospital if you're already experiencing high levels of demand?
Well, there are already some safeguards at the hospital. You must be wearing a mask when you're in the hospital, and clearly we're monitoring the situation at the hospital incredibly closely. You know, there are a lot of pressures at the moment. I think we saw an earlier press release this week from Manx Care about the pressures in the emergency department. But you know, these pressures exist in any normal given winter period anyway. You know, we just need to be aware of the potential for the health service not to be able to function in such a way that it is offering the community the level of protection that we need. And as I said, if we get to that stage, or we get warning indicators that the hospital is unable to cope with emergency cases in particular, then we may need to go to the public and ask them to take enhanced measures to protect the hospital from additional pressures that would come from increased COVID cases also turning up at the same time.
Question for Dr. Ewart. Many times in our press conferences you said you couldn't give us an R number. Now you produced some. What's happened?
What's happened is different methodologies have been produced for them. This one, as it's explained in the surveillance report, where we actually do set out the methodology and give the reference, is actually a very simple one. The one that has been used across the UK all the way through is an incredibly complex one. In fact, they have about 3 different centres that come up with an R number, and then they have an expert group that looks at the three findings and decides on where it probably lands and what the confidence interval around that is. And the real issue around some of that is the thing that's always been an issue with COVID is to what extent do the ones we've measured, i.e. the ones that have had the positive PCR, reflect the overall numbers in the community. We can't do anything about that. Across, as I say, they've had this incredibly complex methodology which includes all the population surveys that ONS does. It includes looking at what's going in and out of hospitals, excess deaths, etc., etc. So while we were not in a position to replicate that, we didn't. Now there is, as I say, some simpler methodologies, and this methodology that we're currently using really is simple, and it's only based on test results that we can count. But if nothing else, and the caveat is in the document, it's not that good for comparing our R number with the UK, but it is good for looking at how we're changing over time on Ireland.
So our number is, in the minutes?
It was 0.46.
So decreasing.
That was on one of the
Yes,
slides. It's yes.
So you're happy with that?
We're happy with it, but these things can change.
Simon?
Yeah, Chief Minister, do you have a specific number of hospitalisations COVID related that would be the trigger for level 3?
No. In short, we have to take into account a number of factors. I've outlined some of those critical factors, and there's a huge number of equations or points that would need to be considered before we went there. It would have to be a very serious situation. I think the whole point about the winter framework is, one, to provide reassurances that we as a government are still taking this extremely seriously. Second, to send the message that this pandemic really hasn't gone away, and that we've seen it come in waves now. And whilst the current situation is great news, there's no guarantee that we're going to remain like that throughout the winter. But also, thirdly, I think to make everybody aware that if we are heightening our advice, strengthening our advice in certain areas, we are doing so because we are concerned about primarily the pressures on the health service, but also because we want to keep the sort of social and economic framework or structure of the island as it exists together as much as possible, to give everybody the best possible opportunities, whether in business or socially, throughout the winter period.
Thank you.
Yes?
Chief Minister, in terms of schools and the mitigations that are going on there, we know of head teachers who have said that the carbon dioxide monitors are not working for them. Some of them are actively not even using them. What extra mitigations are being put into schools to ensure they're as safe as possible?
Well, I think primarily we have given the strongly advised around face masks to schools, but very much this is in the hands of really head teachers, the Department of Education, to make sure that things are working efficiently and effectively. Now, cases are very low at the moment. Part of the framework view is that we should look where cases start to gather in certain areas to target those specific cases. But Henrietta, do you want to add anything around schools and...
Yes, I mean, in respect of the CO monitors, I mean, the key thing is ventilation. And so most schools, that's what they need to be working round. I do know that some of the older school building stock, actually it's very difficult to do that because the windows don't open, etc. A CO2 monitor is only any use if you can actually act on the results. So it needs to be thought of as part of a pathway, not a standalone, and it's obviously not a mitigation in its own right.
But just beyond that, your department, public health gave advice to the Department of Education as well on this, sending a Tim written answer about it. But this also means that teachers are saying that they want to see more from the government leading on this, and we're just sort of seeing, you can't just tell 7-year-olds to sit with the window open in December. I don't see where this extra mitigation is coming from.
I'm sorry, why can't you have a window open in a class of 7-year-olds?
Because parents don't really want their children sat in a cold room if they've got to sit in their coats on.
Well, that's about the messaging, isn't it? And actually part of that messaging is wear extra layers. Don't expect to be sitting in a light cotton shirt in December anyway. And that is messaging, and yes, sometimes we don't like it. Maybe we'd like to be sitting there in our t-shirt with the windows closed and the heating up, but actually that's not good from the COVID perspective, so people need to understand that and the balances.
I think part of the problem with that was possibly that the windows would only opened about 2 inches or something in some schools. Is that sufficient, if there's a few of them, to actually get enough ventilation?
Anything's better than nothing, and obviously sometimes it's about how you can get a through draft, so multiple windows rather than just one window. And then if it's really difficult, you have to think about other mitigations, which might be around desk spacing, and certainly for the older children, use of masks. That's not really a practical option for primary school.
Can I just ask, if you're asking questions, it'd probably help everybody if you just give your name, organisation, and then ask the questions, just so that everything's clear.
Alex Watton, BBC. How does this affect, if at all, the border policy, and when, if ever, are you going to free up travel for those that aren't vaccinated, or is that not an eventuality? Well,
the COVID response group is going to look at the border policy. We don't feel the need to change the border policy at the moment. We think actually the island is in a relatively stable place and in a relatively situation, but in the winter plan it does indicate that come the springtime, end of March or April, that we will be looking probably to change our border policies at that period, but it's a situation that we are keeping under review at the moment, but no immediate changes likely.
On from that, cruise lines, are they coming in or not? Because so far nothing's arrived, yet you're telling everyone we're sort of open for business, you've been double jabbed. Why hasn't there been any? And are there plans to get that back on?
Well, I'm not sure any...
Come on, Ireland TV.
Thanks, Paul. I'm not sure there's any cruise liners scheduled at the moment, Paul. I don't know what the schedule is, but there's that again will be a matter that the COVID response group will look at. Clearly, that particular avenue of tourist industry is not really available during the winter. Primarily, that's spring, summer time, and we'll be looking at that how we manage that over the coming months. So.
Sam Turton, Jeff. Just in terms of these levels, level 2 would suggest avoiding crowded spaces that aren't well ventilated, which could be seen to include some bars and restaurants. Will the government be able to switch on salary support, for example, if that is deemed necessary?
Well, Sam, I mean, again, we've got a pretty flexible series of levels until we get to level 3 when things get really tough. I think the point is it's a mix of advice. We're saying we may give stronger advice around certain situations, and look, when you're saying to people, we strongly advise or we now ask you to wear a mask in certain circumstances, there's always going to be potential questions. The critical point is that everybody needs to take responsibility. The government can't define and determine for every single eventuality. The critical point is if you're going out to a bar or a restaurant and there is a heightened level of alert around COVID, then do the sensible things. Take a lateral flow test, or going off to a party, take a lateral flow test, wear a mask on public transport. Don't expose yourselves to vastly unfamiliar situations where you don't have to. So this is really about personal responsibility. The government does not want to instruct or intervene in people's lives if at all possible. And we have to say, if we're going to live with COVID and it's an endemic and it's going to stay here, and who knows quite what the future holds, but if it continues to sort of flow and ebb in these waves, then we're all going to have to learn how to live with that, learn when it's responsible definitively to put a mask on when you feel that either you're at risk or you are aware or conscious that COVID is in or around your surroundings, and vaccinations, primary defence, and also the lateral flow tests, which have been remarkably effective. So these are the types of measures, and certainly when it comes to businesses and business support, we will have to make judgment depending on what the whole range of evidence is that's coming through to us.
Simon Richardson, Manx Radio. Question for Dr. Ewart. Are you happy so far with the take-up of the booster jab in the island?
Yes, the issue with the booster jab, of course, is that it isn't all try and get them all through at once, because it has to be paced as people go 6 months or 5 months, 6 months beyond their primary course. So it will take time to complete that. And there have been, I know, some issues about getting that rolled out smoothly, but overall I think it's going okay.
Hi, Ewan Gordon, BBC Isle of Man. I want to ask Dr. Ewart, do changes in messaging actually have a demonstrable effect on people's behaviour? Can you measure whether heightened messaging makes a difference on what people choose to do?
It's very difficult, and behaviour change is very difficult. And it's certainly the case that when you have prolonged public campaign messages, people tend not to hear it anymore. There is, one way of trying to get around that is to try and reframe the messages so that it appears to be a fresh message. And obviously we try to do that. But there is a limit, and also how people hear messages and respond is very varied. And also, if people will change one behaviour, they'll probably change all. So the people who are up for wearing masks will also look out to socially distance, wash their hands, etc., etc. And the people who don't want to wear masks probably don't do the other things. So then what you get is the effects of subtle mixing between the different groups who do the different things, and that's where the transmission can happen quite unpredictably sometimes.
Can I just pick up on that? The messaging has been we should be wearing masks. The government have had this messaging going out and no one's done it really. I mean, government aren't doing it, let's face it, not most of them anyway. Are you disappointed that that's not happening, that even the government officials aren't following your advice? And I'm taking it is your advice to wear masks in confined places with little ventilation.
Yes, when the individual feels that there is a risk to them that they wish to mitigate.
Are you disappointed that government aren't following your advice then?
I think government are following my advice.
Well, not always, are they, when you're in Tynwald or Has
Well,
Keys?
if they're in a setting where they feel comfortable,
Okay.
that is their decision based on their personal assessment of the risk.
Okay, yes.
Siobhan Fletcher, Alban Newspapers. So I've read the WINS framework, I've got it in front of me. I know that you say in it it's difficult to construct specific indicators or thresholds that will dictate moving from one level to another. But how are the public meant to know what level we're in? Are we going to see this in the surveillance report every week, or how are we meant to know where we're at?
Because I'm going to tell the public. So we're at level 1. We're all clear on that. We will make an announcement that level 2 measures are being introduced where we feel appropriate. Okay, so we will make that abundantly clear. It won't be a mishmash. The whole point is that we will make and strengthen the advice, and we will do that, making it clear this is under our level 2 framework.
Finally, a message to people coming to the Isle of Man for TT next year. Your message.
Far too early at the moment, Paul, for me to give a message. Look, I think we're clear. We are looking forward to the TT and a summer season next year. We're going to strengthen the message to everybody coming to the TT as the time gets closer, as we get through the winter. But as it stands today, we're really looking forward to welcoming our visitors, and we will let them know what protocols they may need to follow at the time of their visit.